Good afternoon. My name is Rachel Sayre, and I'm the Heart Disease and Stroke Prevention Coordinator for the South Dakota Department of Health. And I'd like to welcome you to our webinar today, introducing the recently developed South Dakota Quality Improvement Toolkit. During this webinar, we're going to talk through a demonstration of the actual resource to help familiarize you with the content and show you how to navigate throughout the online document. This webinar is being recorded and will be posted to the same site where the toolkit is located so you can reference it at a later date. Before we get started, I wanted to point out a few features of the webinar room. In the bottom right corner of your screen, you'll see a box called Web Links. These links will take you directly to the State Heart Disease and Stroke Strategic Plan and the Quality Improvement Toolkit. Above that, you'll see a box called Handouts, and there you can download a PDF of this toolkit demonstration. The phone lines have been muted to help alleviate background noise. So if you have any questions or comments throughout today's conversation, please just press *6 to unmute yourself. Otherwise, feel free to type into the chat box at the bottom of the screen. Now I'll tell you a little bit about how this resource came to be. In January of 2016, about 24 healthcare professionals began developing a 5-year strategic plan for statewide cardiovascular health. The plan was finalized in 2017, creating a roadmap for preventing and controlling heart disease and stroke in South Dakota. The plan includes 4 different goal areas, each with its own objectives to measure progress toward the goal, and also strategies through which these objectives can be achieved. In each of the 4 goal areas has a work group working toward the area's designated strategies. One of the strategies for the prevention and management goal, which is goal 4, is to encourage implementation of quality improvement processes in health systems. And this is the first thing that the goal 4 work group decided to focus on. So before the group could figure out how to do this, they had to first establish a baseline, and a QI assessment was completed via email survey to do this. The results indicated that there's a pretty wide range of knowledge, staffing, and implementation of QI throughout the state, and it was also evident that the amount of resources available to facilities really depended largely on location, size, affiliation with another healthcare system, etc. The work group decided to compile a list of resources already available related to quality improvement and house them in an easily accessible place on the Department of Health website. And after completing that, the work group expanded this resource guide into a toolkit, which includes more detailed information on the QI process, as well as case studies and additional helpful materials. Work group members from several different organizations provided direction and feedback to put this toolkit together. The hope is that this toolkit will assist many more organizations to become more familiar with QI and their real-life application strategies, and that each user will also be able to incorporate something from the toolkit to either implement, improve, or expand upon quality improvement processes within their own facility. This toolkit is a comprehensive resource designed specifically with our South Dakota healthcare environment in mind, and the diversity and knowledge of the individuals who assisted in creating this resource has really been invaluable. Next, I'd like to take a few minutes to provide a quick high-level overview of the quality improvement process to get us all up to speed. Quality improvement is an organizational approach to managing and improving the systems that support the work of an organization. The quality improvement process describes the key elements or steps necessary for initiating quality improvement. The visual displayed here demonstrates this process. As you can see, the steps in the quality improvement process move in succession of one another and incorporate the plan, do, study, act cycle. This visual of the quality improvement process is referenced throughout the toolkit. So without further ado, I'd like to pass it to Mackenzie Leonard from the Emory Centers to give us a live demonstration of the different features of the toolkit.
Thank you so much, Rachel, for the amazing introduction and important backstory to this toolkit. And as Rachel mentioned, in the next part of this webinar, I'm going to be walking you through the toolkit and helping you get acquainted to all of the really neat components that it has. So whether you're here because you're super pumped about quality improvement, you just really love continuous learning via webinars, or maybe technology is not your friend, I think there's something here for everyone. So I'll just reiterate that if you have any questions throughout the presentation, feel free to add them to the chat box, and we'll either address them at the end or follow up with you directly. So let's get to it. What I have pulled up here is the South Dakota Department of Health website. And as you can see on the tab on the left, there is a lot of really great work being done around heart disease and stroke prevention. And I'd really encourage you to check out some of the exciting initiatives we have here. And for those of you who might be familiar with the Team-Based Care Toolkit, the Quality Improvement Toolkit lives just below it. And it's really designed in a similar, easy to navigate format. So we're going to check it out. And here it is. What I love about this toolkit is the fact that it's basically a one-stop shop for all things quality improvement. So in this first section, you've got the introduction, which really gives some background about what quality improvement is and why it's so important for improving cardiovascular healthcare. And then we've got the meat of the toolkit in the middle here, which explains that quality improvement approach that Rachel just gave us a quick explanation of. And these are the steps that are involved for doing a quality improvement process from start to finish. And then finally, at the end of this toolkit is this resource bank, which has tons of additional templates and web pages, videos, case study examples, appendices, you name it. It's all there for you and compiled and easy to access. So we're going to look at each of these parts of the toolkit today, and I'm going to point out some of the key features to look out for. So before we dive in, I'd love to do a quick poll. So in a few seconds, a poll is going to pop onto the screen, and it's asking you to indicate your level of experience with quality improvement in your facility or organization, or even if it's not your main line of work, just kind of your base level experience or knowledge. So you can go ahead and cast a vote, and we'll show you the results in a few minutes here. All right, here we go. So it looks like we've got a variety here, which is great because no matter where you're at, this toolkit can address your needs. Okay, thank you for participating. All right, back to the toolkit. We're going to start at the top with the introduction. So if you click on the blue text that says introduction, opens up a separate window. And this is really just a welcome to the toolkit. It's a great reference point for anyone who's visiting the toolkit for the first time, and they might not know anything about it. So if you direct your friends or colleagues here, this might be a place where they would want to start. And then to go back to the landing page, I'm going to click over on the other tab here. And just so you know, this orange welcome will take you to the same place that we just were at. So just a little tech tip for you. So in addition, in the introduction section, there is an overview of quality improvement and a section on improving cardiovascular healthcare. So I'm going to click on the overview so we can see what that looks like. So here you have an overview of what quality improvement is, what's the difference between quality improvement and quality assurance, as well as, again, that quality improvement approach and what are the steps, and then some resources down below. So throughout this toolkit, you can either scroll through as I have just done, or if you're looking to just access something very specific, say you just wanted to see the resources, you can click up here at the top and you'll jump directly down to that part. So just keep that in mind. All right, back to the landing page. The next part we're going to talk about is the quality improvement approach. And I'd like to pause and hear from you all again. And if you can use the raise your hand feature by accessing the icon at the top of your screen that shows a little person with their hand raised, I'd love to hear by a show of hands if your organization is currently working on a quality improvement initiative. All right, we're getting a few hands here. Okay, so looks like, you know, not so many of you might be currently doing one. You might have done one in the past or might be considering one. And that's what's useful about this toolkit is whether you're just starting to consider a new initiative, maybe you're in the middle of one and you kind of need some extra support or you're getting stuck, or you're at the end and you want to sustain your progress and make sure that you keep going. This toolkit is laying out each of those places so you can jump in wherever you need to be. So we're going to begin by clicking on this first step here. Leadership creates the mandate for change. And this is really kind of like a preparation step. It's almost like step 0. And this is the first place that you'd want to start. And this step lays out kind of what a team would need to think about to see if they're ready to start a quality improvement effort, including how to build a leadership team, kind of what membership roles might look like, and even how you might hold a kickoff event to build some energy and excitement around starting a new quality improvement initiative. So again, you'll see I'm scrolling through this document. If you really just were interested in one specific thing, say you wanted to know about the kickoff, I could go to the top, click that text, and it would bring me directly there. All right, going back, we're going to click on step 1 now, identify the opportunity. And what you're going to see is that all of these steps are pretty much laid out in a similar format. So at the top, it's going to have that quality improvement approach visual and show you where it falls chronologically among the other steps. So here we're at step 1. Then it's going to tell you a little bit about that step. What's the purpose of identifying the opportunity? What are the objectives you would be trying to accomplish? What prep work is needed by the team in order to do that step? Even down to some suggested activities that the team might be doing, and kind of some information about your first meeting that you might hold, and all the way down to resources. So something I want to point out to you is that in many of these steps, there are appendices which are embedded in the text that are going to allow you to jump directly to an appendix that has more detailed information. So you'll see in this section here, it's talking about first meeting activity, and if I click on Appendix A, that brings up some meeting management techniques. So that's really cool because it's directly related to what else is in that content that you were just reading. Maybe you decided, hey, I need to know a little bit more about what to do in this meeting, and then it pops up here for you. So keep an eye out for those as we move forward. And something else I'd like to show you, we go back to, let's check on step 3, analyze the data. something else I'd like to show you, if we scroll down, is there are these handy tip boxes. So these are throughout the toolkit, and they just give you a little tip related to the content where it's nearby. So here we're looking at working with raw data, summarizing the data, and this tip gives you some ideas on how to mitigate data collection challenges. So those are pretty cool. And something else I'd like to show you, which is also found on this page and throughout the toolkit, are these accelerated QI option boxes. So these are always going to be identifiable because they're big green boxes, and these are meant for teams who already have experience with quality improvement and really only need like a cliff notes on the steps in order to move forward. So if that applies to you, make sure that you check these out and keep them in mind as you go through. All right, we're going to move down to the third part of the toolkit, and this is our resource hub. So let's click on case studies. And this is one of my favorite parts of the toolkit because you get to read real stories from organizations in South Dakota who are utilizing these quality improvement approaches, learn from their successes and lessons learned, and it's just really valuable to see what it looks like on the ground. So I just would like to take a moment here to give a sincere thank you to all of the folks who contributed their time and stories to make these case studies accessible to us all. So a big thank you to Melissa Gale and Heather Bower at Avera St. Benedict Health Center, Sandra Rush and Karen Weber at Brookings Health System, Sandy Josco, Suzanne Parks, Elliot Nelson, Sarah Johnson, Bridget O'Brien, and Jill Swanson at Stanford Health Sioux Falls region, and Nancy McDonald at Great Plains Quality Innovation Network. So let's click on the Avera case study just to see what it looks like. So at the top here are all of the questions that we interviewed Melissa and Heather on, and they are also available as we scroll through, and we can see what their answers were. So, for example, we asked, how did you implement this quality improvement initiative? And I thought it was interesting that they said they focused on each nurse being consistent with how they were taking blood pressures, charting blood pressures. And so this is just really neat because we can learn and compare our own situations with what they're doing, and even, maybe reach out and share success strategies and best practices. All right, we'll move back to the resources section here. I'd also like to point out to you this icon here that says additional resources. There are numerous websites, charts, toolkits, all sorts of things that you can check out to support the work that you may start doing. And additionally, we've provided here a list of organizations in South Dakota who are doing quality improvement. And some of them might be willing to partner on a QI initiative or offer training or funding. So feel free to reach out to them if you think that there might be a match, if you're looking for some support. This is available to you. And now I'd like to show you the resource guide and webinars tab here. So this is where other materials about quality improvement that were developed in partnership with the South Dakota Department of Health live. And one of these resources is the Quality Improvement Resource Guide. This was developed prior to this toolkit, and it's a downloadable PDF with a list of resources for self-learning. And this is great if you can't access the toolkit or you want a comprehensive document that you can share with colleagues or other organizations very easily. What you'll also find on this page is the previously recorded webinars in the Quality Improvement Webinar Series. So this webinar that we're doing right now is the fourth in a series of four. So the previous three covered a variety of important information from how QI impacts reimbursements to population health in QI and its use in rural areas. And you can view all of those webinars here for free. So make sure you check that out. And finally, the last part of the toolkit I'll show you here is the appendices. So like we saw earlier, we were able to jump to this meeting management techniques Appendix A from one of the previous pages on the toolkit. But this is just where all of those appendices live together. And they're pretty neat. Some of them are downloadable Word documents or Excel documents. This Appendix F is clinical practice guidelines that they lay out for you here in a really clean way. So these are all just great to check out. And we hope that these resources can be helpful to you all. So with that, I'm going to conclude the live walkthrough of the toolkit. We really hope this was helpful to you all in getting to know the quality improvement process. If you're getting started or you're keeping one going, this is here for you. So we all know how important quality improvement is for improving population health and patient outcomes. So we're just really excited that so many of you are taking an interest across the state and that you joined us today. So let me see how we're doing on time. I'd love to invite anyone to share in the chat box what types of quality improvement initiatives they're working on or they might have worked on or they're hoping to work on. So feel free to add those to the box if you feel so inclined and would like to share with us. We'd love to hear from you. And we know there's a lot of great work being done. Otherwise, I'm going to pass it back to Rachel, and she'll close out the webinar for us.
Thank you, Mackenzie, thank you for guiding us through the online document. As you can see, there's really a lot of great information within this toolkit. But before we wrap things up, I just wanted to mention two more things. You will be receiving a short survey within the next couple days requesting feedback on this webinar. And I just ask that you please complete it to the best of your ability because we do use those to evaluate the effectiveness of our presentation and take that information into consideration for any future webinars that we hold. Additionally, I'd like to reiterate what Mackenzie said in that there are 3 other webinars focused on quality improvement that have been previously recorded. One on the value case for initiating quality improvement, one for telling the quality improvement story, and then one that is discussing implementing quality improvement within our rural areas. And you can find those recordings, like Mackenzie mentioned, on the webinar at the bottom of the toolkit landing page by clicking on the resource guide and webinars tab. So I hope you'll check those out. And then lastly, I'd like to thank you for joining us today, for your interest in beginning or continuing quality improvement initiatives, and for all of the work that you do to help keep our South Dakota residents healthy. If you'd like to find out more about this toolkit, if you are interested in joining the Cardiovascular Collaborative, or if you'd like to discuss potential opportunities to partner on quality improvement initiatives, please feel free to contact me using the information listed there. Again, thank you, and I hope that you enjoy the rest of your afternoon.